Are you suffering with chronic dizziness? Are you someone who's been to the HENT and they diagnosed you with BPPV, and then they sent you out to a physical therapist, a vestibular physical therapist, who then did the Epley maneuver on you? And you've not only had it done once, you've had it done 3 or 4 times, and you're still stuck with chronic dizziness. Now, people do have crystals in their ears, and oftentimes the Epley maneuver is quite successful in helping people, but it's not the only reason why people suffer from vertigo. And often people are diagnosed with BPPV because they run you through all the head exercises, which do set off your dizziness, but sometimes it's not coming from crystals, it's coming from these joints in the top of the neck. So inside of this top vertebra, right where your head fits, this is the first cervical vertebra called the atlas, sits a structure called the brain stem, and the brain stem houses a nuclei called the vestibular nucleus, which basically coordinates information from the eyes, the inner ear, and the joints in the neck. So sometimes when people are turning their head up and to the right and it kicks off dizziness, it isn't because of the crystals, it's because of the way the pressure is being distributed on this joint from a prior spinal injury, and it's sending bad feedback into the vestibular nucleus and is setting off your vertigo. So if you're someone who's been through the gamut, you have chronic vertigo, you've taken all the medications, you've done eye vestibular exercises, you've done the Epley maneuver, and nothing seems to work, a really good place to look is this upper cervical spine right here. In the office, what we do is called upper cervical chiropractic. It's a technique that's focused only on the upper cervical spine. We take 3D imaging of the upper neck to determine exactly and precisely how the segment's out of position. These misalignments are 1 to 4 millimeters, so we take great care in determining exactly how you're out of position. And then the correction is gentle, it's precise, it's effective. There's no twisting, there's no popping of the neck, and the whole goal is to get the joint that's misaligned back in motion, and the long-term goal is to get it to stay there so the soft tissue can heal up, and from a neurophysiological perspective your body functions better. And in most cases, people who have been from doctor to doctor to doctor with chronic vestibular type problems, they respond beautifully to the upper neck work. So do yourself a favor, get on Google, find an upper cervical chiropractor near you. We're located in Sarasota, Florida. We're happy to help you if you're in the area, but there are people throughout the country that specialize in this type of work. Hope this video has reached people who are suffering, looking for a solution, a natural solution. They want to get to the root cause of why they're suffering. Again, Google upper cervical chiropractor near me.